hey, it's already July 15th, 16th, something like that. And so the semester's almost over. We're in week 7 out of 8 weeks. And so it's going to be sad because this has been a fun class. But of course, I don't really know you guys very well, other than I know your writing and things like that. Let's see, I wanted to cover things like Affordable Care Act today. But first, just like some housekeeping things. We're going to be covering next week Focus On, which is in the back of the book, Focus on Taxing and Spending, which is basically economic policy, and then also in the back of the book, Focus On in Foreign Policy. So keep those in mind that's where those are going to be found. Focus On in the back of the book, Taxing and Spending, and Foreign Policy. Also, we are going to have a final next week. The final will be probably only like 25 questions, maybe 30 questions, and it's going to cover the second half of the class. And so I'll put that in the announcements, like which chapters it is and all that sort of thing. And then also just remember that we need to do our video presentation, local government meeting, or if you do C-SPAN, something like that, so that we can get those things done. And so that's it as far as those things go. Let's see, I also just wanted to cover some of these things as far as what's going on with, I gotta move something on my phone here, it keeps getting in the way. Oh, now my phone's falling over. And so this is what I want to talk about today, because we hear a lot about things like Obamacare, right? And Obamacare is also known as the Affordable Care Act. And so what is Obamacare? In actuality, it's an insurance program. And so people who didn't have insurance, which prior to Obamacare or the Affordable Care Act, there was about 30 million people in the United States that were without insurance. And so they created this insurance program where the federal government will subsidize your insurance if you go onto their website and you apply for it. It depends on your income. It's going to determine whether or not it gets subsidized or how much it's going to be subsidized. And so that's like a big part of like how the Obamacare program works. But it's just like any other insurance that you or your parents might have, as far as you're going to pay a premium, you're going to have like these deductibles, you're going to have co-pays and things like that. So all that's pretty much the same thing. And then the other part that was like a big component of Obamacare, which, we've heard the Republicans, talk so much about like the expense of Obamacare. The Obamacare itself wasn't that bad. It was adding in Medicaid and expanding the Medicaid program that really cost the extra money. And so it basically said that states could increase what the eligibility was, or basically reduce actually what the eligibility was to get on Medicaid. And so that's the part that like really started pushing up the cost of it. But also something that the Republicans were upset about when Obamacare, or the Affordable Care Act, was first created, was that they felt that it was unfair that if you didn't get some sort of insurance, have some sort of insurance for health insurance, that you were going to be fined. And so at the time, the fine could be up to like $2,000 that you would have to pay if you didn't have some sort of health insurance. And so they felt that that was like unconstitutional. But in actuality, it went through the constitutional process, got to the Supreme Court, and the Supreme Court, led by John Roberts, said that it was constitutional, basically saying that they were able to tax industry or companies to help pay for it. And Obamacare is kind of interesting because when they created it, and by the way, this will probably be a test question, when they created it, they used this separate mechanism to fund it. And so, each year we hear about like the budget process, and we even hear about the shutdowns and things like that. They didn't have any of that worry when they created Obamacare, because they created a separate tax that was going to create revenue that was going to fund Obamacare. And so like some of the taxes are on things like pharmaceuticals, or on drug makers, or these types of other things, like maybe a pacemaker they would have some sort of a tax on. If somebody was like getting a prosthetic, they would have a tax on that. And so they basically set it up so that they were going to tax these companies that are producing things that are in the healthcare field. And by the way, healthcare in the United States is around 18% of our gross domestic product. So it's a huge percentage of our gross domestic product, almost 1/5 of it, right? And so the Affordable Care Act was created as an insurance program, and then it sort of started to grow after people started enrolling and all that sort of thing. If you were to like get rid of the Affordable Care Act right now, it would really have a big impact because I've got it written down here. In the Affordable Care Act, there's 8.3 million people that are on the Affordable Care Act right now. But it actually only costs the US government around $55 billion. And again, it's because it's an insurance program, so that's not going to cost as much. Whereas if you're talking about a program where the government has to pay it all, then you're talking about more expense, right? And so as part of that, what other programs does the federal government have, and state governments are involved with this too, that are going to be part of medical coverage? And so the first one I got listed up here is, let's see if I can get this a little bit clearer. I don't even know if you can read this, if it's upside down or not. In any case, Medicare. Medicare is for those who are 65 years and older. You've paid into it your entire life. It's that 1.45% tax that you pay and 1.45% that your employer pays, and then you're not eligible for it to get it until you're age 65. There are some companies and there are some, like state governments, local governments that actually have a retirement program that includes health care, but most people these days are going on to Medicare. And so Medicare has 44 million people enrolled in it. So senior citizens, 44 million people enrolled in it. But interestingly enough, in the next 10 years, they expect it to go to 79 million people. So basically almost double in the next 10 years. And so that's one of those things that everybody in the government's looking ahead and saying, like, that's not sustainable, because look at how much the price tag is for it. $750 billion a year for Medicare. So are we going to be able to move from $750 billion, if it's doubling, let's say it's going to go to $1.3 trillion, right? So that's going to be a huge expense for the federal government, and that's totally funded by the federal government, the Medicare program is. And so really expensive, but a lot of people in it and a lot of people that rely on it. And we're not going to be able to get rid of it, so we're going to have to maybe figure out ways to make it streamlined or ways to save money on it. And by the way, when you look at things like Medicare or Medicaid, it's already saving a lot of money. Like if you go to the hospital and you're on Medicare, the hospital maybe charges $100 and Medicare pays $30. And so, and by the way, that's all anybody pays. And so there's like a much bigger discount if you're on Medicare for the government. So like streamlining it's going to be difficult. And I know we hear a lot about things like, oh, there's too much corruption involved with it. And I'm sure there is, but it's not costing, hundreds of billions of dollars. This may be costing a couple $billion, but we're talking about almost trillions now that it's going to start costing. The next one I've got here is Medicaid, and you can see 70 million people are enrolled in Medicaid. Just to keep in mind with Medicaid, it's also like a big kids program, so there's a lot of kids who are enrolled in Medicaid, and they're going to be, of course, ultimately, you assume off of Medicaid once they turn the age that they can, get a job and cover their insurance, but then, of course, there's always more kids coming along. And so, of course, that's a huge program. A big component of Medicaid to keep in mind is that the federal government pays 67% of the expense, and then the state governments pay 37% of the expense. So 63% by the federal government, 37% by the state governments. And so with 70 million people enrolled, it costs $593 billion, which is interesting, of course, because there's 70 million here, 44 million here. But of course, think about it. When you've got kids enrolled in Medicaid and you've got young adults enrolled in Medicaid, they don't go to the doctor that often. But if you've got senior citizens enrolled in Medicare, they go to the doctor often. And so that's why there's a big difference in the expense there because of that. And then, like I said, since 37% of it is paid for by by state governments, then the state governments have like this extra expense that they have on their budgets. And so, we know that the state governments have to pay for things like the state police. They've got a big education component, K through 12 plus universities. They've got huge pension expenses at the state level. And so, especially in Illinois. And so adding Medicaid in there just adds to it. And when we had Obamacare, and I mentioned that they expanded Medicaid to allow for people on poverty level up to 138% of the poverty level. So the poverty level right now I think is around $29,000. So if you make 138% of that, which would be around $40,000, then as a family of four, then you'd be eligible for Medicaid. Also, you'd be eligible for subsidies on Affordable Care Act, but if you can get on it, you'd be better off on Medicaid, because then you don't have to pay any premium, and you might get a little bit, more coverage on Medicaid. But anyway, either way, it works out fine. And so between those programs, 70 million, 44 million, so that's 114 million, plus another 8 million. So you're talking about 120 million people who are on government subsidized health care. Not to mention everybody who works for the government, the military, all those people. And then if you take a look at state governments and local governments and all of that they pay into the healthcare program, it's a huge expense across the board for many of these governments and organizations. And so it's truly going to be a problem in the next few years, trying to deal with the baby boomers retiring, people living longer, and more people on Medicaid. Certainly more people are going to be on Medicare, and so it's going to be an issue that we're going to have to try to deal with, even more so than Social Security, because of course it's hard to control these expenses when you have so many people that are going to the doctor at those older ages. So that's something as far as the Medicare and Medicaid and Obamacare program goes. Keep those in mind. Those are really going to be true concerns for the government. So that's it for that part. And then, remember to just kind of keep track of some of these things that are due. The video presentation, if you haven't done your term paper, if you're a little bit behind on discussion questions or current events, you can catch up on those things. I'm okay with that stuff. And so go ahead. One other thing, as far as the Affordable Care Act goes, if you're interested in finding out